Last July, the government put forward a proposal to use the COVID fund to refurbish the entrance to St Bernard's Hospital and the Primary Care Centre. It was accompanied by a CGI video visualising the concept. The plans were designed to free up clinical space and to create enhanced meeting areas for patients and visitors. However, no sooner was the project announced, there was some backlash from the public. A petition, which would generate over 1,400 signatures, was launched, pushing for the COVID fund to be spent on other facilities. Speaking on Gibraltar Today, the Health Minister said the government had listened.
Immediately after the election, we decided not to do the entrance project. There was significant backlash on that from the public, so I think it's only fair that we put it to the public to see what the public wants to do with the money.
Difficult one though, no? Because you're going to get 101 different ideas.
Well, actually, what we find is that there will be, if you do a heat map, there will always be overlap in certain areas. So we'll be able to see what the public feels are the main areas. What I would say is that obviously it's on health matters that this money will be spent, because we are already actually receiving emails since the press release was launched this morning. And we are looking to spend this on health-related items rather than more generally in Gibraltar.
No sooner had the government announced the consultation process, ideas and suggestions have begun pouring in.
Derek has been in touch. He says the money should be injected into reinforcing GHA facilities and a proper GHA CT scan, and also to just generally give different staff in different departments more resources.
Absolutely. It's about looking what resources the public generally think we should be giving it to. A CT scanner is one of the options, and I'm sure there are others that people will feel strongly about. So once we start getting the feedback, we will, I'm sure, start to see areas develop where people feel that the money should go to.
John says he thinks the money should go towards bolstering mental health provision, perhaps with a multi-purpose building.
Oh, well, we love that idea, and we're already actually looking at that actively. So that is something that we're looking at. If additional monies can be put towards that, then absolutely. But that is something that we're actively already looking at. We've got a strategy, and we want to move the facility from where it is now.
The public can put forward their ideas on how the COVID fund should be spent by writing to the Ministry for Health, Care and Business on covidfund@gibraltar.gov.gi.
I think that the key message here is that we are trying to listen as much as possible to what people have told us. We've reacted to what they've told us in relation to the COVID fund. We reacted to the entrance, and we're listening across the board. So we're listening to the patients, which are obviously the very reason that the healthcare system runs, and we're also continuing to listen to the clinicians.
The consultation process begins today and ends on Friday, the 26th of April.